Good afternoon, everyone. Welcome to our COVID-19 update for Eau Claire County. Again, this is our media question and answer time. We appreciate you joining us. It's a chance to respond to some of the questions that media have posed to us and have a chance for those to come forward. Also to give you some basic updates and some information on what's happening in Eau Claire. So again, thank you for joining us. Today is December 23rd. We moved the briefing to today, Wednesday, due to many people celebrating the Christmas Eve holiday tomorrow. So we hope that this works for everyone. We have a little bit less information with our weekly data updates that are available typically on Thursdays or Fridays, but we will share with you the information that we have at this point. We encourage everyone to continue to go to our website, COVID-19 Eau Claire, where we will have regular updates throughout the next number of days, even updates over the weekend as things happen. Reminder again that the usual data that we share on Thursdays is not yet available from the state. So that is part of why we will not have all of the data updates that we typically do, but we will give to you what we have. I would like to say, with it being December 23rd, there are many people in this community that do celebrate the Christmas holidays in the next couple of days. I hope people find a time to take a break, find time to see the joy around them. This has been a tough year and a year that we've really been challenged to notice the grace and the joy in one another and in our community. There's a lot of it there, and I hope all of you find a time to do that with each other. In our incident command team, our team that is a large group of people in Eau Claire County that are working together to really respond to the COVID-19 pandemic from a public health standpoint, all of those partners that we're working with all across all the systems in Eau Claire. It was a reminder this morning that not only are we all responding to COVID-19, but we all also have friends and family who this Christmas, if we are a Christmas celebrator, it'll be different. So it's personal as well as a community issue as we move forward through the next couple of days. So I hope you all find time to find some joy and some laughter in that, and also find some time for a break and some rest. We will share with you the state data, the local data, a couple of updates that have happened both locally and across the state, and then we'll answer questions like we usually do. To start with our Eau Claire COVID-19 data, we now have more than 8,900 cases of COVID-19 in Eau Claire County residents since the start of this pandemic. We are now at 8,988 individuals that have been diagnosed with COVID-19. It's an average of 44 cases a day that we are now at, significantly below what we were in the middle of November, but certainly well higher than the 10 cases a day that we are looking for to get to a more manageable spot. I really give enormous thanks to everybody in this community that is working hard to get the case numbers lower, to slow the spread of COVID-19 in this community, and to take the pressure off our hospitals and those that are providing follow-up in their public health world and providing follow-up in the clinical world when people are sick enough to need that kind of care. It makes a difference, and it will make a difference in our community. We currently have about 360 active cases of COVID-19 in Eau Claire County right now. Those are people that are isolated to stop the spread of disease, and all of their close contacts are staying home for that 14-day quarantine period to make sure that they are also not infectious and potentially spreading COVID-19. There have been an additional 13 people hospitalized since we talked last Thursday, a total of 280 Eau Claire County residents that have been hospitalized at some point for COVID-19. And we now have 71 Eau Claire County residents that have died related to COVID-19, an increase of 4 friends, family, neighbors 4 people that have died of COVID-19 since last week, Thursday. It is slowing, and that is really good news for all of us, both again, personally and professionally, those of us that are working on slowing the spread. But it's still high, and it's higher in some parts of our county. I would particularly call out that our case numbers in rural parts of our county and in rural areas across the state for both cases, hospitalizations, and deaths continue to grow. So I particularly make a plea out to the rural parts of our communities to really lean into those basic mitigation strategies. Stay home when you're sick, get tested, make sure you keep your circle of close contacts very, very small. Particularly during this holiday season, don't gather in large groups, and make sure you wear a mask when you are out with people that are not part of your household. A couple of additional data points that we share with you once a week. Our jail testing data as of Monday, a couple of days ago, there were 362 individuals connected to the jail that have been tested. 25 individuals have been found to be COVID positive, with 22 of those people recovered, so having completed their isolation and infectious time. Our UW Eau Claire data shows us that about 15% of our total cases have been connected to UW Eau Claire since the beginning of September. Again, and a decreasing percent of our total cases are UW Eau Claire connected. Our case numbers from UW Eau Claire continue with the testing that's happening there, and we really give great kudos to UW Eau Claire for continuing their testing protocols. Even with students not in session, they are continuing with testing and have been since Thanksgiving, when students stopped being in session in person. And that makes an enormous difference in our community to have regular testing happening of UW Eau Claire students, faculty, and staff. Public health investigations. We are at 72 public health investigations in Eau Claire County, as listed on the state website. About 3/4 of these public health investigations are in settings like education, work sites, or other group settings. 1 in 4 is in a long-term care facility related setting, so those settings where people are residing for long-term care reasons. At a state level, we are considered a county at very high COVID rate. Our activity level is considered very high. Again, a better spot than we were at in November, where we were at the highest level of activity level. Now we're at the second highest. Just for context, we are at 638 cases of COVID-19 in a 2-week period. Any county that is over 360 cases in a 2-week period is considered in that very high activity level. We have a long way to go until we get out of very high and just get into that high level activity. Our goal is to be below 150 cases in a 2-week period. So again, we're at 638. Our goal is to get to 150 in that 2-week period. A reminder then that the usual metrics we share with you, that tracking of data that we do weekly to get a sense of where we're at with how COVID-19 is progressing in Eau Claire County, those will come out tomorrow. Those are state level data that are not released until late on Wednesday or sometime on Thursday. So we will get that data out when we have it, and we'll update our metrics on the website. Our state data for Wisconsin, we are now at more than, we're actually at 463,591 individuals that have been identified as COVID positive since the start of the pandemic, more than 15,000 new people since last week, Thursday. At a state level, we are at very high, with some counties still being in that extremely high category. We have more than 4,600 Wisconsin residents that have died related to COVID-19 since the start of the pandemic. Again, an incredibly high number of individuals and families impacted in the most devastating way by this disease. That number of people dying of a respiratory illness is really unprecedented for the kind of illnesses that we've dealt with in the past, certainly much, much higher than any influenza that we've seen in recent years. We are glad to see, though, that hospitalization rates continue to stabilize or go down, and our death rates seem to be stabilizing somewhat, although we did have a very high number of deaths reported in recent days. The overall daily count is, on average, staying fairly stable. We are working together to continue that trend. A couple of announcements and big announcements at a state level. Certainly, vaccination for COVID-19 is the biggest effort that's happened in the last couple of weeks and will continue for the near term through the beginning of all of 2021. We anticipate that, like disease investigation for cases and like testing, vaccination will be a large part of what we do in Eau Claire County in responding to COVID-19. The state is doing that as well. Last week and this week, we had our first frontline workers in our healthcare systems vaccinated for COVID-19. That's good news. We shared that with you last week, and we know more individuals have been vaccinated this week. And we know more vaccine will be coming to the Eau Claire area over the next several weeks for that highest risk population, those people that are working frontline in healthcare situations where they are directly working with individuals that are COVID positive or potentially COVID positive. Healthcare workers have been prioritized by the federal government and the state government as the first line to receive COVID-19. The vaccine is slowly being manufactured and coming out. The amount of vaccine that we have available is much less than what the need is, even for those frontline healthcare workers. But as it becomes available, we're confident that the state will be continuing to ship that out locally. Again, the local health department and our local incident command doesn't have a role in deciding how much vaccine arrives in Eau Claire or who gets it, but we are working with all of the people that have identified that they are willing to be vaccinators, those entities that can give vaccine. We have met and are coordinating about how to get vaccine out in this community as we have it available. Right now, our institutional partners, our hospitals primarily, are really faced with the daunting task of giving vaccine to their employees. And that's a big job, and it will take a while to get that piece done. As that is completed, we will be getting to healthcare workers that work outside of that hospital setting and be making sure that all healthcare workers in this community have an opportunity to get vaccinated. Just a couple of reminders again, healthcare entities, the 1A population that many of you may be hearing about, our healthcare workers, one of our jobs right now is to make sure that we know who all of those people are in Eau Claire County. So we are identifying that group, that population as a whole, making sure we know where all of the clinics and all of the providers are. We will be reaching out to those entities and especially those that are not otherwise affiliated with a large healthcare system, those single primary care institutions or those eye care locations or chiropractors or physical therapy offices, all of those healthcare partners. We will be reaching out. Our incident command and our partners as vaccinators are committed to working with you to make sure that we have vaccine available once we get vaccine allocated to us in Eau Claire County. Certainly do know that we are right now finding avenues to reach out to you, and we will be in touch as soon as we have vaccine. Our prioritized groups at the moment are those direct service providers that are working with people that are COVID positive, including our EMS team. So that is who's getting vaccinated right now in Eau Claire, and eventually we will get to vaccinating all the rest of the 1A populations. The health department and our incident command team does anticipate that we will be providing vaccination clinics through our mass vaccination structure that we've done for things like flu clinics and other types of clinics When we get vaccine here locally, we will be notifying partners and eventually notifying the community when we have enough vaccine available for all of our individuals in our community. We will be getting that information out as we have it available. We also want to give a little bit of update about testing. We know that many new messages were released related to testing at a state level this week. The governor announced yesterday that there is a new in-home testing protocol that is available, a testing resource that individuals can access for free in Wisconsin. That's a Vault test. The company Vault is providing a test to individuals that request it to do an at-home observed test. There's good information on the state website about this resource available for all Wisconsin residents. It did roll out yesterday. There are tests available for people that in certain circumstances it might be easier or more convenient or more appropriate for that kind of a at-home testing process to happen rather than people coming to one of our really strong set of in-person testing options. We are fortunate in this community to have continued clinical testing sites as well as our National Guard testing sites. So we really do have good testing availability in this community. The Vault at-home test provides one more avenue for testing for our community residents. More will be available on that in the days ahead, and we certainly will have information available on our website to remind people of that resource. A reminder that that test kit takes a little bit to order and arrive at your home. If you are symptomatic or if you are a close contact and need to get tested, please make sure that you take advantage of our clinical testing sites or our Wisconsin National Guard testing sites. UW-Eau Claire also continues to partner with us on testing. They will continue to be providing testing for their faculty, staff, and students second semester. So when they are back in session, they'll have their ongoing testing protocol happening. They also, after the new year, will have for a bit longer their community antigen testing site available. And when those hours are set, we will make sure that they are available and available for people to access at our website. So that antigen testing, community testing site at Memorial High School, that is a partnership with UW-Eau Claire, will be available a bit longer in January. It's not available through the holiday weeks, but in January we'll be back again for a bit of time. And then UW-Eau Claire again will be committing to testing faculty, staff, and students on campus and off-campus students through their testing protocols once school is back in session. We are fortunate in this community to have many options for testing, and we continue to encourage people to get tested. It's one of our most important strategies in order to slow spread of COVID-19. We also want to make sure people are aware of a new contact tracing app. This app was announced by the state this week. It is coming live and is available for people to use. The idea of this app, and many states across the US are using it, is that if an individual that is COVID positive notifies via the app those people that were in close contact with them, again, that 15 minutes of 6 feet or closer, any individual through Bluetooth technology that would be identified as being a close contact would get noticed via this app. It's a notification process that happens automatically if the individual says that they would like, if they're identified as COVID positive, that they would like to push that notice out. It does give people the opportunity to know that they are a close contact and to go to our website and follow the instructions there as a close contact to quarantine. It's another tool in the toolbox, and we hope people see it as a resource. I today, my children will be shocked to know, did go on my phone. I figured out how to activate that app. And it's an opportunity for me to, if I become positive, for my close contacts to be notified. So if my children opt in to the app, They will be notified when I push the button if I become positive that they were a close contact, because those household contacts of mine would be considered contacts. Again, the app is only one tool, but we see it as an important one for people to consider utilizing, and we hope you take advantage of that. You can do it now, or you can wait until the state does a push of this app out to Wisconsin residents. It's my understanding that they will be doing that sometime this week. It should be simple when you get the prompt, but you can also go into your phone and quickly do it right now if you choose to. I would remind everybody that as we move forward with these additional advances, whether it's the contact tracing app or the upcoming vaccinations that will be happening in the community, or even the increased testing capacity that we have, all of those things are good tools in our toolbox. We also need to remember that our best ways to avoid rapid spread of COVID-19 is to keep distance, keep 6 feet apart or more, to make sure we wear a cloth face covering in every situation where we may be in closer contact with individuals, and to stay home when we're sick. There's just some basic common sense practices that we will need to keep doing as we move forward. Many of those things are very easy to do. Some of them, frankly, are a bit more difficult for us as time goes on. It's hard for me to stay 6 feet apart from people that I'd love to give a hug to. But I think we also know we can do it. We know that, yes, we would love to be giving those hugs to people that we care a whole lot about. And right now we can care about them more by making sure that we have distance from them and finding other ways to show that we care. So again, a reminder that even with all of these advances in technology, advances in resources, all of which are enormously important in our response to COVID-19, we still have to keep up with some of those basics. And we are counting on each other doing that, especially through the holiday season that is upon us. So I will do some questions from the media that we got in advance. If the media that are on the call have additional questions through the chat box, Audrey will be monitoring that, and Audrey will also open it up for media questions when we get to that point. So the first question is, do you encourage Eau Claire County residents to take part in the new statewide app that I just spoke about that launched today? Again, yes, over the next several weeks, people should get a push notification about this app. I guess it's the next couple of days. I would encourage people to take advantage of it. It is, again, not tracking you in any way except through this Bluetooth technology. It will give you notice. It will give you an idea if you need to be concerned about being a close contact, and it will give you that resource so that you can start making sure that you're not spreading COVID-19 to others, just in case you were near enough to a person that was infectious to get the disease yourself. Again, even more important, please don't put yourself in situations where this app is the only way to make sure that you are not spreading disease. Keeping distance will be your best strategy. It would also mean that even if you employ the app, that you don't get noticed because you never were in a situation where you were closer than 6 feet for more than 15 minutes with someone that was potentially infectious. Next question is, do you encourage residents to order at home COVID-19 tests that the governor announced, these vault tests? And is there a specific group or demographic for whom this test would be specifically useful? I do encourage people to consider ordering a test, especially if they are in situations where it is likely they may be in close contact with someone that is COVID positive. Having that test available at home to utilize quickly is one resource available to you. It is also a resource for those people that may be, because of their work schedules, because of their ability to have transportation, because of their place where they live, that may make it more difficult to go to one of our existing testing locations. If someone works days and never can get into a testing location because of the hours, for example, having one of these tests available might be a good thing to have at home. For people that have really unreliable transportation to get to a testing location, it may be, again, a good resource for those individuals. For some people, if you are noticed that you are a close contact of someone that's COVID positive and you would like to do a test at that 6 or 7 day mark during your quarantine period to see if you've become COVID positive, again, you could right away order one of these tests and do it at your convenience rather than scheduling a time to go and get tested elsewhere. So there are certain situations where it may make sense. There are other situations where it may not. Again, you need to have reliable internet access. It's an observed test. You need to have an email that you can order the test and that you can receive information to a unique ID connected to your email account. So there are certain circumstances where it may not be the best option for you. Again, we're fortunate in this community to have a lot of other testing options available. And then the final question we got in advance is, can you speak to the accuracy of this at-home COVID-19 test? The specific one that's available to us now, which is the VAULT test. Are they more or less accurate than the rapid antigen test or the PCR test? This VAULT test is a PCR test. The PCR test, again, is our gold standard for COVID-19 in really detecting disease accurately. It is a PCR test. It's considered by the state and by the feds as being the most accurate way to understand if you are currently infected with COVID-19. Better than an antigen test at this point, especially for those people that are asymptomatic. And really a good, reliable test, if it's observed and is done correctly, is seen as a reliable test to utilize in the circumstances that are described. So with that, again, a reminder, COVID19eauklear.org is our webpage. We've put a lot of work into having good information at that website for people that want to learn about the data, learn about testing locations, learn about vaccination and what we know currently about vaccination for COVID-19, to learn about what to do as a business partner or as someone that is working with our community partners. There's a lot of good information there. We really encourage you to continue to go to that website and look at all those updates. We do work with all of our community partners through various ways, schools, businesses, all of our healthcare system partners in an ongoing way. But we also want to make sure that the community knows that there is a lot of information on that website for you to stay informed. We also want you to know that the COVID-19 call center, that number is 715-831-7425. That call center number is a way that you can leave a message and someone will get back to you quickly. We will have call center staff available this week, including Thursday, part of the day. Friday, we will not be returning calls on Christmas Day, but we will be checking messages through the weekend and we will be responding to calls as we can. Back again then on Monday with call center staff available to answer your questions. So thanks for joining. I will turn it over to Audrey, who can share with me whether or not we have anybody that has shared any chat questions.
No questions in the chat box, so would anyone like to unmute and ask a question directly?
All right. Thank you, everybody from the media joining us. Thanks for everybody else that's listening into this. I hope you have a wonderful holiday. If you celebrate the Christmas season, I hope you find joy in that celebration. And we will be back next week, Wednesday, December 30th. Again, a different date than usual, but with the New Year's Eve holiday that many people have off, we will be coming to you with our media Q&A session next week, Wednesday, in order to provide some data and updates as well as answer questions. Thank you, and we will talk to you then.